Welcome to MythBusters ADHD edition. My name is Dr. Catherine Garforth from Garforth Education.
Hi, my name is Selena Lee. I am the ADHD Whisperer.
We are working together to dispel some common ADHD myths.
All kids with ADHD are hyperactive, and some kids are ADD without the H for hyper. And this has to do with the change in terminology. We get our diagnostic criteria from the DSM, which is the Diagnostic and Statistical Manual. It's currently in its 5th edition, and each edition creates changes to definitions and terms based on what the research is telling us. And so it's trying to make it so that things are as consistent as possible and can be used globally. And so there used to be attention deficit disorder and attention deficit hyperactive disorder. They have combined those into one term now, and there are 3 presentations. There is a hyperactive impulsive presentation, the inattentive presentation, and the combined presentation. So depending on the presentation will depend on whether that hyperactivity is a component of the diagnosis. So a child or an individual that has ADHD inattentive or primarily inattentive presentation means that they don't have that hyperactivity as part of their condition. So it is just that they're having that struggle to maintain the focus, and they don't have that same need for that movement.
Yes, and it's also how that presents, because you can actually be hyperactive with your thoughts internally and not show it externally. Or you've managed to, young children, everything's external, and then they slowly bring it in internally with their development stages. All their thoughts are straight out their mouth when they're young, and then they realize that not all the thoughts that they think has to be coming out of their mouth. So I find sometimes my mind is just all over the place with my thoughts, and it's actually hyperactive thoughts. It's distractions and thoughts coming through all the time, knocking each other out. And I could just sit there and not look hyperactive and not display it externally, but still feel it internally. And I think the coping mechanisms for many people do that as they get older. So they can change from what would appear hyperactive and be diagnosed the hyperactive. And then later, because of coping mechanisms and not wanting to appear out of the norm, they have internalized a lot and they're still hyperactive, but you can't see it because of their coping mechanisms.